Well, there's some new research out of the UK, and it's looking at the impact of vaccines on so-called long COVID. Now, the research focuses on the chances that vaccinated people will suffer long-term health effects from a breakthrough infection. So for more, let's go to Tessa Arcilia. She's in London right now. So tell us a bit more about this study, Tessa, and what it actually found.
Look, Michael, long COVID is something that is a dreaded effect of COVID-19, but we don't really have a lot of data on what it means long term until now. So this study published in the Lancet Infectious Diseases today, it was led by King's College London. They found that for people who have had 2 doses of the vaccine, that they can cut the risk of catching COVID. But also, if there is that rare chance that they do get COVID despite being vaccinated, they will not suffer the consequences of long COVID, that the risks are cut in half. So this is a study of 1.2 million people, Michael, looking at that between December last year and July this year. And of the 1.2 million, only 0.5% had that breakthrough infection. And of those, only 5% had long COVID. So it is a very, very small number. I did speak to the lead researcher today, and this is what she said about the study. Take a listen.
Found that there was a significantly reduced risk of people getting long COVID if they'd been vaccinated. And so that's really important news, and it's the case in all age groups. The chances that you have absolutely no symptoms at all are about doubled if you've been vaccinated.
Now, this is great news, Michael, for, this long COVID has been a worry, especially for younger people getting it and not knowing how long they will be having debilitating effects and symptoms of this. But of course, all age groups are open to the potential of having long COVID, defined as having symptoms for 4 weeks or more. And some people, Michael, going on to have them for months on end with just no answer in sight. So this study today is good news for those people. Michael?
Now, that is good news for people who are fully vaccinated, but there's still a note of caution here about spreading the disease. Tell us about that.
Absolutely, because first of all, this breakthrough COVID that they're talking about, the infection, it is very rare. But for those people who might have had COVID, you might not have symptoms. If you're fully vaccinated, you might not know that you're carrying the disease. This, of course, poses a risk to those who are extremely vulnerable. So the researchers were saying, still be cautious, still test yourself regularly to just make sure you're not carrying the disease and you're asymptomatic. Now, here in the UK, they're already looking at giving that third dose to extremely vulnerable people, Michael, very aware of all these unknowns still up in the air. But this latest development does show just what kind of positive impact having 2 vaccines, or at least being fully vaccinated, has on people. Michael?
Okay, Tessa, thank you for that. Tessa Arcilia in London.